Hello, I'm Dr. Evan.
And I'm Dr. Zach.
And we're with Advantage Chiropractic. And this care package was made for you. It was given to you by a loved one, a friend, a family member. And on this care package, we're going to talk about neuropathies. And when it comes to neuropathies, the things that we want to really arm you with today are three major things. We want to talk about where these neuropathies come from, what you can do at home to start combating these neuropathies, and then last but certainly not least, give you opportunities to really take some action steps to correcting those neuropathies so that you don't have to deal with them anymore. Now, when it comes to those neuropathies, there's three main things that those neuropathies can stem from. Number one, it's going to be a structural component. Number two, a muscular component. And then last but certainly not least, a neurological component.
Exactly. So let's talk about those three to start, okay? So the first one we're going to talk about is that structural piece when it comes to any of those neuropathies. So the big thing is when we look at our spine, we have built-in curves for protection. Obviously, we walk on two legs so we need to stand up too tall, but more importantly, protects neurology going all the way down the spine. So when we're looking at any of those neuropathies, such as carpal tunnel syndrome that everyone hears about, or that sciatica shooting down those legs, we have to look at the structural component. So especially up here in the neck, especially that lower part of the neck, if we have any structural issues where it's straightening out, or it's actually going the opposite way, it can lead to a lot of that neuropathy, that tingling down into the fingers. Now let's go down to that low back when we're talking about sciatica, same exact thing. We want to have a nice curve, and if that curve straightens out, if we have any rotation being put in there, it starts to go the opposite way, we're going to see some of that pain shooting down into the legs, okay? The second part is the muscular aspect when it comes to it. So again, when we don't have those perfect curves built within our spine, those muscles will start to pull and tense in many different directions, and also leading to what are called entrapment sites. When we have some of those entrapment sites, if it's in the shoulder, if it's in the elbow, if it's again in the low back, the hips, we can have some of that pain shooting down in the hands, shooting down the legs, and all those neuropathies going on. Third, most importantly, I should say, is the neurological component. So the neurology from the brain all the way down to the tailbone needs to be functioning perfectly. And if it's not functioning perfectly, again, here in the lower neck, here in the low back, it's going to have some of that nerve pain shooting down in the legs, shooting down in the hands, where we can't sit down for a long time. We can only drive for an hour and a half. We have to get up every 20 minutes at work because we're not able to sit down and do our job.
Now what we want to do is we want to talk about activities that we want you to avoid when it comes to neuropathies. So the first neuropathy that we're going to focus on is the one stemming from the neck, going down into the arm, all the way down into the hands, known as carpal tunnel. The one activity that we absolutely need you to avoid is leaning on a desk, especially right on the elbow there. Whether you're doing it to the side or if you're working, you got both elbows there, you're typing there, using the mouse, you have to avoid these things, otherwise it can cause that carpal tunnel to get much worse. Now when it comes to the neuropathies for lower in the lower back, known as sciatica, when it goes down into the legs, we want you to avoid one thing, and this is mainly for males, but it's the wallet. So Dr. Zach, if you want to show them the wallet. When it comes to a wallet, what it's actually going to do is it's going to cause your hips to be imbalanced, which is going to cause your spine to be imbalanced, which then puts pressure on the nerves. So instead of putting it in your back pocket, it's a very, very simple thing. Put it in your front pocket, especially when you're sitting. The key here, make sure you're doing it while you're driving. Think about sitting on it for hours when driving there. Always put it in the front pocket. And then the last thing that we want you to avoid, and this is both male and female, is crossing the legs. Now, I know this is difficult, and sometimes you get the urge to where you absolutely have to cross your legs. So instead of crossing at the knee, like you see here, what I want you doing is cross at the ankle. It gets rid of that urge to cross, but it leaves the hips in the correct position instead of crossing all the way up and over.
All right, so let's talk about some stretches and exercises we can do to help combat those neuropathies that you've been having. So again, let's start with that carpal tunnel syndrome stemming from the neck all the way down, having that fun numbness tingling going down into our hands, okay? So the first, very, very simple, we are just gonna do a neck range of motion. So what I want Dr. Evan to do here is perform these range of motions so you guys can do them at home. So the first one, we're gonna do a flexion and extension. So I'm gonna have him look all the way down, good, and then all the way up to the ceiling. Perfect. So what I want you to do is 10 each way for a total of 20. The next one I'm gonna have him do is look over his left shoulder and then come back and look over his right shoulder. Again, perfect. Again, 10 each way for a total of 20. The final one, I'm gonna have him take his right ear and come down to his right shoulder. Perfect, and then back up and go the other way, left ear to left shoulder. Awesome. Now remember guys, when you're doing any of these stretches or exercises that we're going to be giving you today, make sure it's pain-free. If you guys are having any sharpshooting pain, any horrible soreness afterwards, stop doing it. Give us a call. Again, this is going to be individualized. We can tailor it towards whatever your needs are. The next one we're going to do is called Brugger's position. So I'm going to have Dr. Evan do here is put his palms out. Perfect, just like that. He's then going to roll his shoulders up, back, and down. And you notice what he's also doing? He's keeping a great head posture, so he's bringing his head back as well. So we're really gonna open up his chest here, pinch these shoulder blades together, and it's really gonna help loosen the muscle, and that's really gonna help alleviate some of that carpal tunnel syndrome pain that you can be having. The next one I wanna talk about is when we're having sciatica. So I'm gonna have Dr. Evan come over here and perform this one. So the big thing what we wanna look at when it comes to sciatica is the piriformis muscle. So one simple one that we're going to teach you today, and again, you can look up many different piriformis stretches, but the one I want to show you today is if you're sitting down in a chair. What I'm going to have Dr. Evan do is cross his legs up. Perfect. And then what he is going to do, he's going to, with his left hand, push down on his knee, and he is going to lean forward. What that's really going to do is going to start stressing that piriformis muscle, which is down in your glute area. A lot of times, the piriformis muscle tightness can lead to a lot of that sciatica pain that we've been having. So these were just a couple stretches and exercises that we can be doing to help alleviate some of those neuropathies we've been talking about. If you have any questions, please just give us a call. All right, guys, those are just some simple stretches and exercises and things you can be doing at home to really combat the problems that you've been having. So the big thing is we got to see if it's neurological, if it's muscular, or if it's a bone issue, or a combination of those three.
Absolutely. So seeing as you have this video, it was sent to you by a loved one, by a friend, we want to let you know that you have an opportunity for a completely complimentary consult and exam with us. And the goal with that is to really figure out if it is neurological, if it is structural, or if it is muscular, or those combinations that we were talking about, to really give you those answers on what you can do to really correct what's going on, so you can live the life that you want to live. So if you have any questions, if you're interested in setting one of those up, call us at the office, 262-505-5610. You'll speak with Melissa or Sierra. Make sure you mention that you have one of these videos, and we'll ultimately get things moving in the right direction. Thank you so much, and as always, live the advantage.